Right. So welcome everybody to our next seminar of this year's International Women's Day seminar series. It is my great pleasure to welcome today Dr. Helen Richardson Foster from the University of Central Lancashire, who is going to tell us a little bit about her research on responding to domestic abuse under COVID-19. So over to Helen. Helen, it's really great to have you here today.
Super, thank you, Carolina. Yes, welcome, and thanks for inviting me. So yeah, I'm going to be talking about a research project that I've worked on called the Dahlia 19 study. I'm going to be telling you lots about that, but I just thought I'd begin by explaining a little bit about myself and where I work, in line with the International Women's Day theme, and also just to give you an idea of who I am and where I've come from. So, well, I work at the Connect Centre. I'm going to move that back. So I'm a researcher, research fellow at UCLan in the School of Social Work, Care and Community in the Connect Centre. And my journey to working there, I've worked there for about 5 years now. And prior to that, I did my PhD in Sociological Studies Department at Sheffield, where I looked at child protection conferences in cases of neglect. And prior to that, I've had a sort of mixed career of working both in universities, looking at support for families and domestic abuse and social work interventions, but I've also worked in the charity sector, but always as a researcher. And I began my career down at what was called the Trust for the Study of Adolescence. Then it became Young People in Focus, the charity that doesn't exist anymore, sadly, but that was exploring the intersection of research about supporting teenagers and young people, but also their parents and practitioners who work with them. I think that's been a bit of a theme in the work that I like to do. It's very sort of looking at practice and supporting families and understanding the experience of them in response in particular areas such as domestic abuse. So I've found my place to work at the moment, my happy home of the Connect Centre, which is led by co-directors, our Professor Nikki Stanley and Christine Barter. And here we do research which is about understanding, preventing and responding to interpersonal violence and harm. And by that, we're looking at violence between individuals, all forms of sexual and domestic abuse, violence to adults, and also the abuse and neglect of children. And so we do a number of research projects, and you can find out about them on our webpage, which is down the bottom. We also have PhD students, and you might be interested in that we have monthly webinars which are free to attend. You're all welcome to come along to those on a range of subjects that we explore. So yeah, there's our email address. Sorry for the random blue box that's appeared on there. So you're welcome to join our network if you'd like to. But today I wanted to talk to you about the domestic abuse harnessing learning internationally under COVID-19, the Dahlia study, and just to share some findings from it, and also an area that I worked on particularly was the deep dive case study that was exploring a particular area of practice that I thought might be of interest to you. So, and I'll come to that later, but just to tell you a little bit about the study and give you some background. So it was a 4 nations or 4 countries study with the 4 nations of the UK as well. And it was led by Professor Nikki Stanley, funded by the ESRC, and it took place within all of the UK, as I said, Australia, Ireland and South Africa. And it was about exploring policy and practice and the response to domestic abuse during COVID, and yeah, capturing what was happening at that. We realized that we were in a time of great sort of change and stress, and we wanted to explore what was happening, what the response, what we could learn from the response, and the purpose was to really to be able to disseminate findings to stakeholders to inform future policy and practice, to build strategies for recovery, to think what if there were more lockdowns in the future, and how can we take the learning from this difficult time for future domestic abuse services, both in the UK but also elsewhere. And that's what we wanted to draw on practice from the 4 countries. And key features of the study were that we wanted to look at the response to all family members, including children and perpetrators. And we wanted to explore what was happening both from the top down, sort of maybe central or local government and initiated initiatives, but also things that came from the bottom up and what emerged during this time and what can we learn from them and to what extent they were joined up. So the project took place, we began it towards the end of 2020 and it lasted until 2022. And all our study reports and findings from all the 4 countries involved are on our website. So you can find all the detail of what I'm giving you today on there. I should just, very crucial to acknowledge the key role of our stakeholders at this point. So we couldn't have done this work without the cooperation and the help and the involvement of our UK stakeholders, and the international partners also worked in partnership with similar organisations in their countries. So you see them all listed there. We were very thankful, in particular to the Domestic Abuse Commissioner for England and Wales for the office's support for our work as well. And as I say, it was funded by the ESRC. Before I tell you a little bit about how the findings and what the key findings were and how we did the study, I just wanted to think about, cast our minds back to 3 years ago now and think about the background and the context of the study a little bit more. And if you can recall, at the beginning of the pandemic, in this time in 2020, 3 years ago, there was a lot of concern about the risks for domestic abuse victims, survivors, and the concerns that domestic abuse was going to increase under the restrictions that have been put in place to manage COVID-19 and the lockdowns that we saw. And, there was worries about confining women and abusers to the home whilst cutting off access to the usual sources of support and advice when services were being temporarily closed, and we weren't sure what was going to happen. Was that going to lead to a big rise in domestic abuse cases? And we did see some statistical, some stats coming through that there was some evidence of increases in recorded levels of crime, reports to the police, increases in domestic homicides. What we certainly saw was increased demand for domestic abuse services in 2020, particularly at the points when lockdowns were changing and lockdowns were lifted, with, for example, a 22% increase in calls in 2020-21 for refuge, and also calls to Respect Men's Advice line increased as well. So there was this sense of concerns about a massive rise in levels of domestic abuse, but certainly an increase in demand and concern, and people wanting to access support through helplines and websites. And we do also know that at the time in 2020, refuge services were very much affected by restrictions on social distancing requirements, a lack of move-on accommodation, concerns about safety and PPE equipment. And we also know that there were delays in criminal justice services, especially the courts, because of the lockdowns and restrictions to services. And there's lots more detail about that in our report, but you can remember the context for sort of conducting this study. So this is where we were at in 2020. We wanted to explore what was going on and how people were responding to this time and the changes. And this is how we did it. We had a methodology that included a combination of methods. We started out with a mapping study, a rapid review, where we put out a call to evidence with all our partners who are in the study. The 10 partners are listed, but also went much wider than that and asked for what people could tell us about what changes they were seeing in their services and how they were responding to providing domestic abuse services in the pandemic. We also consulted with our stakeholder organisations through a series of webinars, and with survivors through our survivors advisory groups that we set up with meetings in England and Wales, all done on Zoom and by webinars, I should say. We then conducted a number of expert interviews with people from practitioners and policymakers from across the field in all 4 nations of the UK. And we did a survey of domestic abuse coordinators in local authorities in England and Wales as well. And then we conducted a case study, deep dive into one particular area, where we conducted some more interviews and drew on data from the wider study. And I'll tell you about that later on. And we brought it all together in a thematic analysis where we looked at a number of key questions around the reach of interventions, their acceptability, how accessible they were, if there was any evidence of their impact for survivors, what were some of the key sort of barriers and challenges around implementation of new interventions, and what we could learn from this in future about what recommendations we could have for maybe strengthening capacity of domestic abuse services in future, and which ones held promise for the future. So we tried to sort of pull all those together in our UK study, but also in the other 3 countries that were involved, use the same thematic analysis. And so just to pull out some of the key findings before I tell you about the case study, something that came out, right from the off was around public messaging and awareness raising. And this is something that came out in the consultation that we did in the interviews. There was a real sense of entrapment being an experience that the wider public could share and empathise with. There was lots of messages to stay at home at the beginning, to protect the NHS, to save lives, as that image shows us there. If you can recall back to that time when we were just all absolutely had to be staying inside. But the domestic abuse sector lobbied the government to recognise the impact of this message on survivors and think about what were we saying to those experiencing domestic abuse, and how we could reach out and ensure that there were awareness of support services. So there were things like the You Are Not Alone campaign. And there's a real value there expressed in our participants of messaging coming through strongly from the top about domestic abuse being recognised, and we're aware of it. There was also the context of high profile media coverage around the murders of a number of women, including Sarah Everard, Nicole Norman, Bieber Henry and Sabina Nessa, and a sense of kind of an increased awareness of domestic abuse and violence against women and girls at that time in 2020, I think. So I think the change in public awareness was a key finding from our studies. One of those things that's quite difficult to sort of measure in a public sense, but certainly that came through from our participants, a key finding. In some senses, we discussed whether there were some missed opportunities to capitalise on this increased awareness of domestic abuse and the need for support for victims. For example, we discussed with people in a public health role in our interviews whether there was consideration of raising awareness of support services at vaccine and testing centres. And this quote there is, people were saying, well, we weren't sure about that. It was more important to save people's lives, get them vaccinated, and have very clear messaging in the vaccination centres or in the test centres about this is what you must do and this is how you proceed with what we're asking you to do here, say in the test centre. And so there was some a sense of reluctance or hesitancy there from the public health people that we spoke to about whether more could have been made of those opportunities to get information out about domestic abuse in those kind of health interactions. And another sort of qualification there is that we noticed that there were fewer messages aimed at children and young people and perpetrators. A lot of the public messaging was around you are not alone, there is help for you as a survivor, as a victim, maybe less so about how children perpetrators could get support. Another key finding around the theme of adaptation was the switch to remote service delivery, something Caroline and I were just talking about at the beginning of this call. So we all know about the change to, doing things on Teams and on Zoom, as we're doing now. And the domestic abuse sector had to swiftly move to online service delivery. In a very short space of time, as I say, there was an increased demand for services, for helpline and for web chat. And so, you know, there was a need to rapidly change how services were delivered and to receive funding for that. And with this, we saw that this led to increased accessibility and engagement for some service users, particularly people in remote areas. There was a value of anonymity, and you know, it provided an opportunity to diversify and create more opportunities for people to get support from domestic abuse services. I love this quote from somebody in the DA sector and service saying, what we learned was that we're bloody good at responding to crisis. We do it daily. We've been doing it for decades, and we really turned things around really quickly. We implemented IT, phone systems, all of that. We did it very, very quickly. So there was that quick pivot, but also a lot of learning and adaptation and looking at what was working. And there was some issues around perhaps delivering perpetrator services online. I know there's been some other evaluations of that are coming through now about how best to support group work for perpetrators of domestic abuse in an online setting. Would individuals, some of our participants from Scotland told us about the support that they did there in the Caledonian programme around still providing face-to-face and outdoor support for perpetrators where that was requested, because sometimes digital and online methods didn't suit everybody. Similarly, with providing perpetrators support, there were concerns about victim safety and how to deliver support for perpetrators and survivors who were all living in the same house. So we heard about some examples of innovation with this, such as, you know, sort of thinking about timing of meetings, or to say to people being having walking meetings outside the house, or coordinating support for the victim at the same time as the perpetrators receiving their support. Issues of accessibility was something that we looked at within our thematic analysis across the piece. And in terms of remote service delivery, there were concerns expressed in our interviews and consultation about language barriers, about issues of digital poverty, and whether children and young people were keen to engage with remote delivery when they were receiving so much support, so much content through school delivery lessons, that would they actually want to engage with more online support from domestic abuse services. And finally, in terms of remote service delivery, and again, there's much more written about this and some interesting work that's coming out now about the impact on staff and the well-being of domestic abuse practitioners and others working in this area when working from home, and the needs to think about support and safety and you know, understanding the impact that it can have on well-being for practitioners. That was one key example of adaptation that came through. Another thing that was interesting, and it's related to remote methods of working, was the way that we saw collaboration across and within sectors in responding to domestic abuse under COVID. So remote communication actually enabled more collaboration and speedier decision making, both at a national and sort of local level, local government level. For example, there was a weekly Zoom meeting that was held with all the domestic abuse services and domestic abuse commissioner and government. And this was also seen in Scotland as well. I know it happened in England and Wales. So it was bringing together people and facilitating an understanding of challenges and learning from each other. That's how people described it. But also it brought everybody to the table, and it sort of provided somewhat of a level playing field across. Say, for example, somebody in Wales said that instead of having to travel all the way from North Wales down to Cardiff to meet with Welsh Government, or to get together in terms of the National Welsh Women's Aid or other organisations, they could all hop on a Zoom and everybody's sort of, participation was enabled. We also saw at a local level, it enabled increased representation from services at multi-agency meetings. And then, so that quote there said, you know, we saw massive engagement in national network. We're still meeting virtually, and that's been phenomenal. And local authorities are attending. So different ways of bringing. I think that was from one of the men's support programs, bringing together local authorities and understanding. So a lot of chances for people to collaborate within the sector, but also we saw other services such as housing, retail, transport, recognising the impact of domestic abuse, leading on from the public awareness, I guess, and being able to think about ways that they could collaborate and provide additional support. And I'll come on to that shortly. Another finding we had, which I wasn't sure how best to explain this one, but in a nutshell, funding for the domestic abuse sector is complicated. There's limited statutory funding. It's been heavily reliant on charity and commission, but also commission services, and it has historically been very patchy and in some cases quite fragile, I think possibly is the word. On the domestic abuse services that we spoke to in this research praised the flexible nature of tendering and the simplified application processes being beneficial to them and meaning that they could swiftly get on with adapting and changing and providing new services. However, there were differences across the 4 nations of the UK on how that was instigated and how it was possible, and there was limited sort of ring-fenced money in Northern Ireland, for example. So I won't go into all of that, and the funding is complex, and again, there's a whole other piece, but just the simplicity of this quote saying it was a one side of A4 application form, tells what you need, tells how much it costs, and they were able to swiftly turn that around and get on. So that was, you know, obviously advantageous and important to recognise. We looked at the impact for minority and excluded groups and of new interventions and what was happening under COVID. And we heard and discovered that existing gaps in services were somewhat exacerbated by the pandemic, particularly services for Black and minoritized groups, people with complex needs, older survivors, rural communities. However, it was difficult to get evidence on some of this. You know, for example, we were looking for what's been the impact, what interventions have we seen for LGBTQ+ survivors or disabled survivors. What we did find was that some initiatives were trying their best to make sure information was accessible, say in all languages and for deaf people and deaf survivors. And one, and I'll come on to one of the examples which was quite positive in terms of you know, thinking about sort of rurality and rural communities. Another positive example was that in Scotland, the removal of the no recourse public funds category was identified as a good policy intervention that relieved the distress and enabled the DA sector to respond quickly to those group of survivors. There were recommendations about retaining that in the long term. And I'm not sure where we're at with that at the moment. And then finally, another sort of group that I mentioned that we were looking at to what extent services were provided and accessible was children and young people experiencing domestic abuse. And what we found was that there was a sense of young people, and especially in 2020, slightly going missing from the service provision, in the sense of they weren't being seen at schools, or school could be avoided. Support was taken away from children with disabilities, and you know, the pausing of services, the reduction in services happening face to face had a real impact on children and young people. And so particularly in 2020-21, there were some real concerns about how young people were being, how their needs were being met, and that concern about what was happening at home. And certainly when we sought evidence of new interventions and responses, it was more challenging to find that, which sort of added to our picture. And then finally, just another group is working with perpetrators. We found some evidence of as I've said already, remote and hybrid support being adapted for perpetrators. Also, we saw some descriptions and some evidence of proactive policing in 2020 and 21, with particularly in lockdowns, and a change in policing and a change in policing priorities. If pubs and clubs were being closed, or then actually police could easily divert attention to responding to perpetrators. In one authority police area, we saw them proactively targeting high-risk perpetrators, and also going out perhaps with support cars and seeking out families who were known to be high risk, and working together with domestic abuse service providers. And then another area that was an interesting innovation in COVID was the concept of rehousing perpetrators, rather than forcing the victim and their children to leave the family home and flee to a refuge, as we might traditionally see happening. And that's what the quote there says, is the idea of stop asking, why doesn't she just leave, and start asking, why doesn't he just stop? To live up to that, we've got to get the policy and practice in place to make a reality. And they were talking about thinking about the practicalities of, could we support perpetrators to be rehoused temporarily and get support. And there was an exciting intervention that took place, funded by the Mayor's Office and Police and Crime Commissioner in London, which we're still waiting for the full evaluation of, that was exploring the use of supported accommodation for perpetrators, that began in COVID. And another point there about the impact of court delays on responding to perpetrators. So I just wanted to just give a bit more detail now on something that's sort of close to my heart, because it was one of the main bits of the study that I worked on, which was an innovation, but also something we're calling a fast-tracked initiative, which we saw happening in a few places, and both in Australia, but also in the study, and also in the UK, where perhaps services that had slightly been thought something that somebody wanted to get off the ground, COVID and the changes in lockdowns and the changes to services almost provided a catalyst to some interesting innovation in service provision, and thinking outside the box really about how can we how can domestic abuse survivors and families have better access to services when they've been restricted. So one way was through the Rail to Refuge scheme. I'll skip over this for time, but if you're aware of this, it was the funding of rail places so that women and children, or survivors and children, could travel to refuges, and it will be funded by the refuge, and they could get on a train and seek a place of refuge and access that support easily, and that was very well advertised. But there is some evidence of impact of that. But the main thing I wanted to tell you about was what we're calling the community touch points schemes. And this is again another sort of innovation and something that came out and really came to the fore in COVID. And I'd like to tell you a little bit more about this. So this is how we're defining community touch points, using this phrase. It's a safe space or a portal from which DA victims or survivors can get information and access expert help. And it's about having it in the community or in an online community space so it's easily accessible. And this is something that we were interested in exploring further, and we used our case study in the UK part of the study to explore it. And I don't know if these are familiar sort of images to you, if this is something that you've come across already, but there were we identified 4 key national community touchpoint schemes. The main thing was the pharmacy's Ask for Annie campaign, the code word, which was the code word campaign established by the Home Office in 2021 and then transferred over to Domestic Abuse Service Hestia last year. There's also Hestia's Safe Spaces scheme, that turquoise circle there, which is the idea of giving access to phone and helpline numbers in pharmacies and in banks. And that was also run in an online way on a number of commercial and public websites by Hestia in collaboration with some other organisations and commercial organisations. And then we also looked at, in Scotland, they had a improving access to community pharmacies in response to rape and sexual assault scheme. And that gave us some sort of similarities and differences to when we were exploring what is a community touch point and how do these function and what can we learn from them. So yeah, that's just a different infographic of explaining what I've just said in the same way. So I'll skip over that. It's just showing who led it and where they were based. And so we were interested in these in our study. I was like, well, what's going on here? These seem like an interesting idea. What evidence is there of how many people they're impacting upon? Are they reaching survivors? Are people using them? Are they working well? And in the duration of our study, the evidence of impact that was coming through was a bit scarce. But we do know that there's been some uptake of them. We consulted with the organisations delivering them and asked for evidence of impact. We know that pharmacies and bank branches were all signed up. We know that the online Safe Spaces was on a number of UK organisations, including rail companies, and that they had nearly 1 million website hits last year, up to last year, but much more now. And Ask for Annie, at the beginning, were recording how many disclosures they'd had in the first year. I should imagine it's much more than that now, but we don't have the numbers for that from the Home Office, and now it's been transferred over to Hestia. So be interested to see as more data comes out from that. So yeah, there's some scarce impact data, but some anecdotal accounts of them being accessible and having an impact on survivors. And from this case study interview, this gives you an indication of, how useful it was for people to say, you could go into this safe space when you go to get your prescription and make a phone call to family members just to let them know she was okay, and then could return to the pharmacy. This woman returned 6 times and eventually left and fled the relationship. And she was able to use the pharmacy space to access local support, to get in touch with an IDVA, independent domestic violence advocate, and to get legal support. We asked in our survey whether people in domestic abuse coordinators were aware of uptake of the pharmacist code word schemes and the safe space schemes, and some uptake was reported, although people weren't quite sure at the point when we conducted the survey as well. We looked at evidence of how accessible and acceptable these new innovations were to survivors. And I think what's key here is that there were new and non-stigmatized spaces to provide information about domestic abuse, to provide information about how to get support, non-judgmental, and putting it out there. The chemists were proudly showing that they offer support without trying to hide it. So it's putting it out into the public space. And it was, trying to be a UK-wide scheme. There's patchy evidence of it across some parts of Scotland and in the perhaps in different areas. And again, it's in our full details in our report, but it was meant to be rolled out across the UK and taken up by a number of pharmacy chains. So in that sense, it had quite a good reach. Although, as noted, there were some issues around whether it was targeted at children and young people sufficiently, and issues around it being provided in a number of languages and information being provided in the right languages and being accessible to all groups. So some of the strengths, as I say, were that it had that wide sort of intent of reach, and there's some evidence of uptake. These Ask for Annie in particular, and Safe Spaces, they got out there quite quickly and were able to show a speed of response and recognition of domestic abuse during COVID. What was interesting, I think, in particular, was the way that these domestic abuse charities, organisations harness their links with partner networks and with private companies to get the online safe spaces scheme off the ground. And they worked collaboratively with pharmacies, with supermarkets to deliver this and to raise awareness of domestic abuse. So like this case study interviews too says that it was about raising the prominence of the issue and, you know, putting this out on all these websites. That is a victory in itself. So perhaps even if it doesn't lead to loads and loads of people seeking support, it's raising awareness, and they may seek support down the line. And I think this quote here is key about the importance of embedding this kind of work and having those spaces there permanently, because we know that people don't just leave, and it's a cycle, and it takes a long time for people to be able to seek support and for change to happen, for people to be able to leave and get the confidence they need to leave. So that's about having these places established and within communities in the long term is important. To say some of the challenges, some of the things that came up around how to implement pharmacy schemes at a time of lockdown, of increased stress on pharmacy staff, at a time of, you know, sort of, they were delivering core services, they were making sure people get their medicines, there was all the PPE requirements. You know, they were delivered in pharmacies because there was an understanding that staff had a base level of safeguarding training already, but there was additional training that was needed to make sure people were able to deliver these interventions and provide the information and have the spaces set up. So this case study interview saying it was a miracle that they kept going, and it involved a lot of commitment and ownership from the staff. As I say, another challenge is that we haven't got a great deal of implementation data and monitoring data coming through as yet, and because of the speed at which they were set up, I think embedding evaluation and monitoring wasn't a key factor for the services at the beginning. So we're not sure, and there's, you know, untapped information there, and we don't know, again, with a limited evaluation and monitoring data, to what extent they were used by particular women and survivors, and if people from different groups and different needs, and that would be interesting to know and change services accordingly. So yeah, some of the points there here, I think already. Some of the things that came out about that was useful here was that the services themselves at the beginning were designed, and survivors were consulted at the beginning of creating these community touchpoints, and that was seen as valuable. But more planning to understand the needs of diverse groups and those in communities subject to high levels of scrutiny, for example, some Black and minoritized women in rural communities may be less likely to use pharmacy services where everyone's known to you, or you might not want to be concerned about privacy. So we may need to sort of take into account the different settings for, say, pharmacy schemes. There were needs, as I said, for training for frontline staff, and some issues came up about duplication of ideas and implementation, and the need to make sure that messaging was clear about the differences between Ask for Annie and online safe spaces. And now the two are delivered by the same organisation, Hestia, which goes a long way to removing that. But that was a bit of a thing that needed to be worked around at the beginning. As I said, monitoring and evaluation. So those are the sort of key things that have come through from the community touchpoints learning, and this is all in our case study paper that I can link you to at the end. We also have some sort of general thoughts just to end on in terms of learning from domestic abuse from the Dahlia study. Messages really for future policy and practice, and just to reflect on that to close. Really, I think what we saw that was useful was that there was specific focus and targeting for funding for the DA sector under COVID, but which also had flexibility, and that was really useful. There was the opportunity for strategy meetings and regular communication between the government and the DA sector that, you know, on a level that hadn't been seen before, that hoping will continue. There was some promise in terms of interventions that, you know, looked at rehousing perpetrators, for example. There was also the promise and the benefit that we've seen in terms of hybrid models of service delivery and, you know, the switch to remote delivery and changes that's led to us all in working practices and support in the future. And as we've seen in talking about community touch points, initiatives and interventions, there's been lots of promising work that's come through and lots of things that point to needing more robust evaluation and research in the future. And so just to close, I've got a little slide there that's got our web page again. So all our reports are on the daily19study.com website. Today we've got a couple of papers that you can find. We've got the new Portals to Safety one, which is about community touch points in health and social care in the community, and I think might be open access, I can't remember. And also there is one from our Irish colleagues about public health directives, looking at the experience. Well, it's written, began with our Irish colleagues, but it's actually covering all 4 countries, which explores more around the public health messaging element as well. So thank you very much for your time today. And oh, and here's my email and Nikki Stanley's email if you wanted more information from us directly. So.
Fantastic. Thank you so much, Helen.
You're welcome.
Brilliant. Do we have any questions? Would anybody want to unmute yourself and ask a question? No, so while you're thinking about it, I was wondering, Helen, whether you could comment on the impact of those new initiatives and new ways of working. So you said, like, during the COVID, everything was done online and decisions were taken more swiftly. So I was wondering whether this actually stayed and is still happening, and whether you actually see the impact of changes that were sort of positive changes that happened during the COVID time.
Yeah, I think they did, in terms of like the national with the Domestic Abuse Commissioner meetings. I think they dipped down to maybe monthly, but when we had a final project conference and the Domestic Abuse Commissioner came along, and they were saying that those networks have been really, you know, important and continued. And I know in terms of sort of future funding practices and conversations that we're having around a new study that we're doing that's across England and Wales, again, it's all happening online, and you know, it's facilitating that. So I think it has just been that big sea change, hasn't it? We won't go back to that. But it's interesting as well because the Domestic Abuse Commissioner is now much more firmly embedded in her role, and the office is growing, and you know, perhaps in some ways that helped kind of, you know, do that piece of work about sort of meeting everybody and getting in and understanding, because they were doing it all online.
Thank you. Anybody else would like to ask a question? No? Then I have another one.
Yeah, go on.
About whether you know anything about how the police support has changed now over time. So you said also that during the COVID time, the lockdowns, the police forces were able to divert or to focus their attention on DA cases. How is it looking now? Because of course, all pubs, everything is open again. So has attention sort of been shifted away again from the?
I think their resources are extremely tight, and I think there's the sense of there are priorities, and they can't have all. Nothing can be absolute priority all the time. What I know has continued and has been interesting it again goes back to the remote stuff, is the use of Zooms and web links and things, and having sort of like video calls with survivors and with families after incidents, and instead of having to come down to the station and to you know, have conversations, they can be done remotely. And there's a benefit of them being less stressful and anxiety provoking, and you know, it can be done at somebody's pace. So I think there has definitely been some learning there from that about methods and yeah, ways of working with responding. But I'm not sure in terms of whether they could actually go out and do that proactive policing anymore. Yeah.
Oh, so much more work is needed, right?
Mm-hmm.
Yeah. Thank you so much. If there are no more questions, then I'll be happy to close this session. Thank you so much, everybody, for joining us today. And thanks so much, Helen, for this thought-provoking and absolutely incredible presentation. Thank you so much.
Thank you. You're very welcome.
Bye.
Thanks.